All right. How do patients want to be communicated with? This is a really big topic when it comes to communication styles. And a lot of times when we're looking at pairing evidence with anecdotal evidence, there's a mismatch between what a therapist thinks is the best way to talk to a patient and what the research shows is the best way. And this is something we got into in residency this week about the communication. And there's a lot of interesting research out there, especially these qualitative studies that dive into what patients value and what they want from a physio. Now, on the front end, they want someone who is competent, someone who is in the research, someone who is able to have a holistic vision, a unique individual. But this fine line that you need to be able to balance as a clinician is to not be in this authoritative, I'm going to tell you what to do, right? Patients want to maintain autonomy. They want to be in a feeling of safety, boundaries respected. They want to be empowered, but they want the clinician to take the lead still. Right? And that's that fine line. So when we look at shared decision-making, or how Dr. Groopman puts in his book, Jerome Groopman, in Your Medical Mind, great book to check out, that talks about judgment-based medicine. It's the clinician who does the assessment, brings out new information, can share the research, different treatment options, the risks, the benefits to go along with it. And it's the patient then who filters that information through their values, through their goals, their beliefs, and they come to a decision together with the clinician. And that's a really hard skill to master, and it takes time, and there's going to be fumbling around. And I'm telling you, it's not about how skilled or how fancy your manual therapy techniques are. You really want to make a difference with your patients. It's learning how to communicate with them and design a plan of care that's important to them. That's what's going to improve adherence. That's what's going to plummet cancellation rate. That's what's going to get them to come back and send friends and family. So really making sure that we're working on communication styles that the patient wants, not necessarily what we want and fulfills our professional pride, or what we might think is a way to tell them what to do. Okay. And so I've got a lot of research on this that's in the post itself, so check it out, and I'll be back next week for more of the topics that we're covering in residency. Take care.